Hi, this is Johnson from Langford. Today we are going to discuss a case note which is roughly based on the question paper of OET exam held on 20th April. In this case note, you are a head nurse in a secondary school and patient Sabrine Wright is a girl student there. Now you are writing a letter to patient's GP for treatment of patient's enuresis and review of unresolved eczema. Here, unresolved eczema means the eczema has already been present for some time and the GP may be aware of the condition. Now let's read the case note. Well, when we get the case note, the first thing that we need to read is the writing task. So let's start with the writing task. Here, write a letter to patient's GP about the current condition and required treatment of enuresis and review of eczema. Letter to Dr. James Livingston, Brisbane, 41 Vulture Street, West End, Australia, 4101. So that's the writing task. And here you are writing to patient's GP, so automatically it's a non-case, and you are writing for the management of patient's enuresis and unresolved eczema. So keeping this information in mind, let's read the case note from the outset. Today's date, 8th January 2024. Note, you are a school head nurse at a mixed gender secondary school. Sabrine Wright is a girl student at your school. She came to see you to discuss her health concerns. Patient details: name Sabrine Wright, age 11 years, date of birth 24th November 2012. Social background: hobbies video games, parents separated, lives with mother and siblings, mother has depression. Medical history: atopic eczema since the age of 6, PRN emollient. PRN means as needed. Presenting complaint: she is anxious about an upcoming multi-day school trip. School records: on 3rd November 2023, she had headache, fell down in class, not willing to attend class. Paracetamol was given, rest 30 minutes and returned to class. 6th January 2024, teacher noticed cracks and bleeding in between fingers. She was brought to me, prescribed emollient cream, main, that means morning, and dressing provided. On 8th January 2024, she presented alone without appointment, anxious about multi-day trip, appeared embarrassed and restless. On discussing, she cried and told about bedwetting, that is enuresis. She afraid her friends finding out her condition during trip. She seeks letter of exception on health grounds. Eczema still unresolved, cracking, bleeding. She agreed to reveal condition to GP. Plan: management of enuresis and check compliance with the emollient. So once again, writing task: write a letter to patient's GP about the current condition and required treatment of enuresis and review of eczema. Now let's write the letter and start with address. In the address part, we have 4 points: date of writing, address of the recipient, salutation of the recipient, and regarding. So the date of writing is 8th January 2024 and address of the recipient, Dr. James Livingston, General Practitioner, Brisbane, 41 Vulture Street, West End, Australia, 4101. And regarding Sabrine Wright, date of birth 24th November 2012. Here in this case note, we have both date of birth as well as age. So whenever we have both, just go for date of birth. And now salutation: dear Dr. Livingston. Now coming to the intro, whenever we get a non-case, we tend to write, I am writing to update you on. It is not appropriate in all cases. Update the recipient if the recipient has at least a vague idea about patients presenting complaints. If not, just write like, I am writing regarding your patient, or I am writing to inform you on, something like this. And in the intro, we need to ensure that we write patient's full name, disease condition for which we write the letter to, and purpose. Now, well, coming to our letter, let's write it this way. I am writing to inform you on Sabrain, right, comma, your patient, comma, who has enuresis and unresolved atopic eczema. She requires further assessment and management from you. Coming to the second paragraph, we have three records, school records, and the first one is of 3rd November, second one is of 6th January 2024, and third one is 8th January. And let's go with the second record as that seems the starting point of patient's current issue. So on 6th, the teacher noticed cracks and bleeding in between fingers. She was brought to me means the nurse who is writing the letter, and prescribed emollient cream main. Main means morning, and dressing was provided. So we have nothing to ignore in this particular point. Let's write it this way in our letter. Sabrain was brought to me on 6th January 2024 by her teacher after noticing cracks and bleeding in between her fingers. Her wounds were dressed and emollient cream was prescribed to apply in the morning. Now coming to the third paragraph, let's write today's events. Today on 8th January, she presented alone without appointment, anxious about multi-day trip, appeared embarrassed, restless. On discussing, she cried, told about bedwetting. She afraid her friends finding out her condition during trip, seeks letter of exception on health grounds, eczema still unresolved, cracking bleeding. She agreed to reveal condition to GP. These are the points that we find in today's record. So let's summarize them in this way. Today, Sabrain, appearing embarrassed and restless, has returned alone without appointment and confided. Confided means reveal something in private about her bedwetting habit. Currently, she is anxious about an upcoming multi-day trip as she is afraid that her friends may find out her condition during the trip. In addition, her eczema is still unresolved. As a result, she is seeking a letter of exception on health grounds but has agreed to disclose her condition to you. To you means the GP you are writing the letter to. Now, as a fourth paragraph, you can write what happened on the 3rd of November 2023. So on 3rd November 2023, she had headache, fell down in class, not willing to attend class, paracetamol given, rest 30 minutes, returned class. So let's write it this way. Please note, on 3rd November 2023, she had a fall in the classroom secondary to headache and was initially unwilling to attend class. However, she returned to class after resting and being given paracetamol. Now, we don't need to write anything regarding patient's social history as it is a known case. So let's conclude it this way. Consider the above, it would be appreciated if you could provide treatment for Sabrain's enuresis. Kindly review her eczema and ensure her compliance with the emollient cream. And now, if you have any further queries, please do not hesitate to contact me. Yours sincerely, School Head Nurse. Well, this is the letter and it is not the exact case note. I compiled it after gathering details from my students. So if you find it worth watching, please like, comment and share with your friends. Thank you.